Okay, good morning, everyone, or good afternoon if you're on the East Coast. This is Dr. Matthew Heisey and Dr. Grove Higgins coming to you live from Centeno Schultz Clinic and the Neuroathlete Clinic in Monument, Colorado. There we go. All right, so today we're gonna do our third series and focus on the lower extremity of the hip, knee, and ankle. And so we're going to kind of talk a little bit about the part 3 hip, knee, and ankle webinar outline. We're going to introduce ourselves and do our telemedicine, telehealth alternative to surgery consultations, kind of the update on that. We have some interesting data that we've learned as a country on the current COVID-19 and the pandemic and the resources, the peak. We're going to go over a little bit again on how to do some more telemedicine consults with your provider. We're going to try to do a live knee ultrasound here in my office on another one of my physicians as an example. We're going to dive into the exercises, rehab, pain relief, what to do at home. We'll talk a little bit more about those resources. And then, of course, we want to make sure everybody has the contact information for some telehealth with myself, Dr. Higgins, or any of our partners at Centeno Schultz Clinic. So as kind of a physician, we want to talk a little bit about what we do and how we can help people. I'm board certified and fellowship trained, and we practice interventional spine, interventional orthopedics, pain management, sports medicine, physical medicine, rehabilitation. My group, as well as myself, we have numerous research papers that we've published on our techniques, and that's one of the links there. In my downtime, I'm mostly spending it with my 2 young kiddos, and then I like to, of course, enjoy all of Colorado. So mountain bike, snowboarding, paddle boarding, hiking, camping. Our practice, Centeno Schultz Clinic, has our Broomfield, Colorado location, and then South Denver, Lone Tree, Colorado location. So we'll let Dr. Higgins introduce yourself, please, sir.
There we go. Need a microphone. Hi, I'm Dr. Grove Higgins with Neuroathlete. Like Dr. Heisey, everything Colorado. The only reason to live here is to be active outdoors, and have 3 kids, and 2 of them are in another part of the clinic right now, practicing their violin and doing videos for people right now. But we're here in Monument, Colorado, and online everywhere as well. My background, I spent 4 years in a biomechanics lab, so did a lot of my early learning on 2-dimensional screens, so it makes it very easy for us to see and diagnose problems in a telemed type of a situation. I've been part of quite a bit of research over the years. So really excited to be here and help anybody that needs it.
Excellent. So Dr. Higgins and his team will dive into some of our specific exercises here shortly. I'll just kind of take this back over. Okay, so we have some new folks today that I haven't seen the last 2 webinars, so just a quick overview. Like Dr. Higgins mentioned, he's been doing telemedicine for his athletes throughout the country and the world for a long time. Right now, because of the kind of shelter-in-place, stay-at-home orders, insurance companies, the federal government, et cetera, has allowed physicians, physical therapists, chiropractors, occupational therapists to do the telemedicine consultation. So what does that mean? Well, we make it really simple. We send you a link, just like today. You click on that link, and you're either live on the phone or video conferencing with your provider. And you could use a laptop, a tablet, your personal cell phone, your computer desktop, etc. The benefit that we have is that we maintain all of our patient communication, established rapport with new patients, and of course, it's being covered by insurance. That way we can get through most of the symptoms in your history, the updates, where you are in your rehab exercises prior to an in-office visit. Right now, physicians are still, of course, essential, so we're able to do in-office appointments. We're able to do some basic in-office procedures in the exam room, injections, draining knee fluid, etc. It looks like we just got our poll results up as well. So we have some patients, I think 25%, this is their first webinar this week. And we have about 38% of our attendees are not a patient of either clinic right now. So thank you guys for filling that out. And then we also see that knees and hips are 25% of the pain. Great, because that's what we're going to dive into. Ankle and low back, 13% apiece. So we can briefly cover those things. So when we do need to see patients in office, we're going to talk a little bit more about the precautions we take with the virtual waiting room, waiting in your car before you come into the office, or procedures, and we'll kind of go into that in a second. The other benefit of the whole telemedicine or telehealth is that, again, new patients and follow-up established patients. Our practice has self-exam videos you can fill out. We can assess your range of motion, your pain, your stability. We're able to practice in all 50 states. That way, our patients and the physician and provider can understand exactly kind of what's happening in lieu of that first or repetitive office visit. Okay, so one thing that we do see is that, of course, hospitals, ERs, urgent cares are where patients go when they have shortness of breath or high fevers for care. So if we have a planned surgery, how do we get an alternative for our pain? If we had a surgery that was canceled, a knee replacement, a maybe low back surgery, a scope, an ACL rotator cuff, Achilles surgery, things like that. So how can we help you? We have the conservative side with the physical therapy, personal trainers, and chiropractic, and Dr. Higgins is going to dive into that at length on the second half. And then on the kind of the physician procedural side, we're able to help avoid hospitals and surgery centers by doing interventional orthopedic and spine care. And that means that we're able to use the needles, ultrasound, and x-ray to inject the orthopedic system, bones, tendons, ligaments, meniscus, labrums, things like that, precisely to then kind of stimulate a healing and pain relief cascade. So that's kind of what the interventional orthopedics approach is for pain management, as well as functional gains, as well as being proactive so that your arthritis doesn't get to the point where we need a total joint replacement. And so kind of that approach, the four-prong approach, is stability, the neuromuscular control, the articulation of the joints, your shocks, your spacers, your cartilage, your meniscus, the left to right symmetry on the body. So we kind of use all four pillars here to figure out why we're having an overload on the right ankle and left hip perhaps, yet your knees and back are okay, or vice versa. Maybe it's all, focused on your low back and your hips, but your ankles are okay. So we kind of use this approach to figure out how the nerve controls the joint stability of maybe a loose ankle ligament, and that's why your back hurts on that opposite side. Okay, so when we kind of dive into all the specifics of how we help our patients, sorry, a little bit too fast. I like to use this slide to go over all the specific structures. So right in the middle is an example of your hip joint, okay? So there's a lot of different inside tendons, hamstring tendons, labrum, cartilage, hip flexors, joint capsules, the glute muscles, the IT bands that are connecting around the hip joint. And so we're going to kind of talk today about pain in the front of the hip and what that means versus pain in the back of the hip and what that means. Same thing with the knee. We're going to dive a lot into the knee because there's so many aspects of the knee, and this is where we're going to do that live ultrasound to look at all these structures. Hamstrings, lateral ligament. We're going to look at the patella tendon, the quadricep tendon, see if there's any fluid in the joint, etc. So most patients are able to have injections, manual therapy, chiropractic adjustments, muscle activation therapy on this system, the ligament, tendon, bone, to help. If we go one slide back, we're going to be able to help this stability, articulation, symmetry, movement patterns, the neuromuscular control. With that, we get pain relief. We're able to then teach these exercises for patients at home. There's only a few of us in the country that are able to do all these specific targeted injections with ultrasound and x-ray. We'll show you a little bit about that today. So when we talk about the hip, I like to think of the hip for my patients as pain in the front of the hip or pain in the back of the hip. Posterior pain, anterior pain. So here on the right is looking at the back of the hip joint. You have a glute muscle, these small muscles that connect to the pelvis, the tailbone, these specific SI joint ligaments that go down to the hamstring. Then this is the big sciatic nerve. So if we look at the back of the hip joint, it's mostly muscle, bone, and nerves. So when patients say their hip hurts and they literally point to their back of their butt cheek, I start to think, okay, is it the low back disc, the tailbone, the SI joint referral, the glute muscles, the sciatic, the piriformis, all of these structures that we want to figure out on examination. So now we can, walk patients through self-exam of the structure, and then of course we can do the hands-on examination as well. When I start looking at front of the hip pain, I start to think more of hip arthritis, a tight hip flexor in the front, as well as a labrum squishing, labrum tearing, labrum impingement, labrum degeneration. So that's kind of how I usually break it down. A lot of people tell me that they have hip bursitis and they point directly here to the outside of their hip. And what that usually is are these big glute muscles, and then you have a white tendon. It's about a 3 centimeter attachment. So a lot of people have tendonitis here. So that's something we're able to figure out on ultrasound and physical examination for our patients. Once we figure out the diagnosis, of course, the rehab, the pain reduction strategies will take hold. So we'll kind of dive into the knee, and we'll cover this a lot more when we do the ultrasound. Inside of the knee towards your big toe is medial. Main structures are the inside joint, cartilage, meniscus, medial ligament. The lateral or the outside towards the baby toe, we look at the lateral meniscus, lateral ligament, and the large popliteus tendon on the outside. The anterior in the front of the knee, a lot of people talk about when I bike in Colorado, when I hike or ski in Colorado, the front of my knee hurts or right behind my kneecap. We're looking at patella tendon, quadricep tendon, the cartilage behind the kneecap. There's a ligament that holds the kneecap in place. Anterior cruciate ligament, one of the soccer, basketball, lacrosse, skier type injuries, ACL tears. In the back of the knee, posterior hamstring, posterior cruciate ligament, and then a lot of us get a Baker cyst in the back of the knee. So we're going to kind of look at these with ultrasound today. Ankle ligaments and ankle tendons are going to support the bones of the ankle. So those are usually the most important things of the ankle, because as we age, we all get wear and tear of the cartilage. So today I'm going to do an ultrasound to focus on the knee, and then we're also going to try to chat or talk about hip pain. If it's in the back and you feel it in the back, again, we're looking at the spine or SI joint tailbone muscles and how we can kind of control these, whether that's lacrosse ball, foam roller, muscle activation exercises, things like that. The ankle, we'll talk a little bit more about that later. Okay, so when we see our patients still in office today, what we have created is what's called a maximum protection zone. So when I see patients, and I'm not in my office, I'm in my office right now, I will be wearing a mask and gloves. We have ordered test kits for antibody testing for all of our patients and providers and staff members, and we expect those to come in next week. They're a little bit delayed. We're also going to ask our patients to kind of stay in the car, what we say is a virtual waiting room, and then you can come into the office. So that way we're making our physician office safer than your home environment with the use of UV filters, HEPA filters, masks, gloves, testing protocols, vital signs, temperature checking on the way in, limiting the flow of our patients so there's only one patient at a time actually in the office. When we do have symptoms or we do want to try to prevent the spread, this is kind of the general guidelines from the CDC, and these are always going to be the same. Don't touch your face, wash your hands as much as you can. You can wear a mask or a bandana in public. We were supposed to kind of see the peak in Colorado this week. I'm going to show us and everybody some new resources and graphs that we've had created out of Washington that shows some of the peaks. General symptoms. Let's say you do have mild symptoms. Please call your primary care provider and stay home. You might even want to quarantine from other family members that might be sick. More moderate symptoms with chest pain, shortness of breath, higher fever, we absolutely need to call the doctor, your primary care doctor. And sometimes if those symptoms get worse, that's still a potential ER visit or urgent care visit. But we recommend you call the primary care doctor first. And that's, again, why we have all these telehealth options available throughout all medical providers in America right now. Emergency, sudden severe chest pain, you stopped breathing, you can't speak without catching your breath, that's usually going to be more of an emergency 911 situation. And then the providers, EMS will walk you through that. We still want to mention high risk folks, immunocompromised from a lot of diabetes, chronic steroids, certain medications, certain diagnoses. If you had an organ transplant, if you're an autoimmune disease patient on certain medications, elderly above 65, asthma, COPD, smokers, heart failure. So we want to make sure those high-risk patients still kind of practice social distancing and stay at home. All right, so this is kind of some of the new slides. This is updated today. This is Colorado from the what we call the graph of resource utilization. So what this means is we're seeing the peak right now. We're seeing the peak in Colorado right now of hospital beds, hospital ventilators being utilized. Now, this is actually good news because we should go on the downslope moving forward. Hopefully, we can prevent further spread. So Colorado, we're kind of on top of things, and we've really shut down a lot, right? If you can see the stay-at-home order March 26th. Before that, restaurants were shut down. Before that, the ski resorts, tourism industries were shut down. So these are stronger than our neighbors in Nebraska, Utah, Mexico, Kansas, etc. So given kind of the population in Colorado, I think we're already flattening the curve based upon this live data. Now, the USA, the entire country, each state's grouped together, and we're still seeing that we might have a little bit more in some states, but overall, the US is 4 days past their peak curve. And this is data out of Washington, and they've been studying this for a long time, the Institute for Health Metrics. So IHM. So this is showing us that overall, we're starting to flatten the curve. So all that is great news for everybody. These are the self-assessment links that we can individually email the patients per your joint, whether it's the neck or shoulder, etc. We're going to continue these. Next week, we're going to talk about the spine, a little bit more neck and back pain, and then we'll go into kind of the arm, shoulder, elbow, wrist. Contact information, so I'll kind of leave this up for now, and then we'll switch over for Dr. Higgins to kind of chat, and then we'll dive into our live ultrasound demonstration. Okay, are you back, Dr. Higgins?
Yep, there we go. There we go. So, yeah, so one of the things I'll reiterate that Dr. Heise said was that, and what he's particularly good at is helping to discern that difference between pain that's coming directly from that joint and pain that's masking and that's coming from the back. It's very often that we see people with pain in hips. That's actually a back-related pain, and not that they don't have something wrong in the hip as well, but the two of them have to be addressed oftentimes to be very successful, and that's something that Dr. Heise and the whole Centeno Schultz group is very, very, very good at. And has helped many of my patients. The benefit to today, before we get into the actual exercises and such, is even if you don't feel like you have much in the way of any kind of knee, ankle, or hip pain, that especially since there's so many people with back pain, is that your back pain had to start someplace, and a lot of times it starts very low. And so a lot of the things that we will show you today will help you with that other pain that you may have, even though you don't feel like the lower extremity is much of a problem. So I think that Dr. Heise, do you want to go into that ultrasound first, or you want to do it after the exercises?
Okay, so we'll switch over. Everybody give me a minute or so to get ready. Thank you. Okay,
Yes.
this is Dr. Sarah Pastoriza. She's our lovely knee model today. And this is one of our procedure rooms where we have our procedure ultrasound as well as our x-ray machine. And so what we're going to kind of demonstrate is just the basic knee anatomy. And then I think that might help us go into some rehab exercises. So the ultrasound shows us bone as white structure, just like a fetal ultrasound. The baby is going to be nice and skeleton white looking, and then the fluid is black. So when we first look at her skin and muscle, and her white bone, we don't see any fluid in the joint. Now, if we squeeze the leg, we can kind of see this little black fluid. So that's relatively normal. She has a little bit of inflammation, not bad. And can everybody see that ultrasound picture?
Could you zoom in on the ultrasound?
You guys zoom in on the ultrasound. All right, so right now, when I look at the front of the knee pain, I like to look at the quadricep tendon as it inserts into the kneecap, called the patella. And so this is relatively normal. There's no holes in the tendon. It's nice and white. I can see the structure, lines of tendon, smooth bone. As we come down, I see my kneecap and patella tendon. And same thing, I like to see lines connecting bone to the kneecap bone. So no tears. And if I move a little bit to the side, I see a nice thigh bone, and I see thick, nice black cartilage. So the ultrasound is telling us a lot of information that we might not need MRI to see. Now I'm kind of going through the joint again, looking at the skin, the tendon, thick cartilage on the thigh bone where that kneecap slides. So now we're going to look at the inside of the knee. So if we have inside knee pain, you look at the inside of the knee meniscus right here. I'll be able to zoom in. A ligament that runs up and down that holds it together. So what we like to do is see if there's a hole in the meniscus or fluid coming out, and then also how loose it is, like loose lug nuts on your car tire. So I'm going to try to stress her knee and see if it wiggles. So we're going to focus right there in the middle, and I can see that meniscus, wiggling in and out, separating the bone. So that's a little bit of, former college athlete, track and field, stressing out her knee. That looks pretty dang good, though, for most of us. So that's kind of how we diagnose the inside meniscus. We'll look on the outside as well. Take our zoom button off, I think. All right. So I see my thigh bone. Then this is going to be that lateral meniscus space right here. Then this is going to be our shin bone. If I look a little bit behind the knee, now this is going to be that small bone and the lateral ligament. I like to see this white line. That's that lateral ligament. And then right here is my little popliteus tendon, this little circle in white. So I like to look at the same things: outside ligament problems, popliteus tendinitis problems, meniscus problems, lateral collateral ligament issues. And then I go a little bit behind the bone and I see the hamstring tendons. We can also see the hamstring tendons on the inside. So this is how we use the live ultrasound to help diagnose our patients. And then when we look at the self-assessment examination on the knee, we want to know if it's hurting on the front of the knee, the inside, the backside, those hamstring tendons down low, the calf, Achilles tendon, inside ligament, outside ligament, the big toe. Does your foot roll flat, or does it go the other way like a chronic ankle sprain? And does that cause pain in the front of the hip or the outside of the hip? So all those things we kind of want to work with our patients. So that's kind of my little ultrasound of the day. I thank you guys for watching, and then we'll go back to Dr. Higgins for our exercises, okay? Thank you.
All right, excellent. All right, so you got me now. All right, I'm going to share a little bit of a screen. We'll go through real quickly here. If you didn't make the previous webinars, we go into the nature of pain and where pain really comes from, and ideas on how to get started in trying to help yourself with pain. And in particular, we did some sciatic nerve work. Oh, I need to push the play button here. Anyway, so go back to those previous webinars so you can get more information on that. Today, we're going to go through real quickly the training rules, and then we're going to go through what you can do for ankle, knee, and hip pain, and other things that you can do to help yourself with your pain in these areas. And even if you don't have pain, how it can help you. So real quickly, some real quick rules. Number one rule, no pain. There should never be any pain. When you're doing any of this stuff, even when you're laying down, try to maintain good posture. You can do any of the things that we're going to be showing you in the standing, seated, or lying down position. And after we get done with today's video, Pat and I will shoot quick little components for each of the body parts that we're showing today, so that way you can go back and just see those drills, because we're going to be flying through a lot of it pretty quickly. We don't want to go too fast, but at the same time, we want to be respectful of your time. Make sure that you're breathing constantly. You shouldn't need to hold your breath with any of this. You're not picking up heavy weights. And even when you're picking up heavy weights, you shouldn't be holding your breath a ton either. There's an appropriate amount of breath you should be having, but during all of this stuff, constant breathing will help you manage pain and tension as well. Make sure that you hit these areas with precision. We're going to be showing you specific targets for most of this stuff, so make sure that you can feel it there. Move with the least amount of tension. Again, this is not hard stuff, so you shouldn't have to force anything. And when you're doing these things, tension, when you're feeling tension, that stretch, that's usually what you'll feel before pain. So respect that, learn to respect that amount of tension that you're doing these drills with. And then stay within the confines of your rehab program. If you've been given rehabilitation by a physical therapist or by Dr. Heisey or any of the other Regenix doctors post-procedure, stay within the confines of the guides that they have given you. And then if you have problems with any of that, of course, make sure that you ask. I know Dr. Heisey and his team will clarify anything that you need clarified from their standpoint. And then if you need more hands-on directive type of care, we would love to be able to provide that for you from our standpoint from NeuroAthlete. And again, remember, no pain. None of this should hurt. Stretch is okay, but pain is not. So moving on, and then try all of these drills regardless if you have your pain, right? We've been talking about that. And we're going to be doing closed chain as well as open chain kinetic movements here. And you might be surprised at what happens when you help yourself at the ankle, how it might help your knee, your hip, or even your back. And you can try these things out. So diving into the ankle, I'm going to step in front of the camera, Amelia, if you don't mind. And I'm going to start out with the foot and the ankle here. And Pat, you can tell people what they need to know here. Now, there's a lot of things going on in the ankle, which we won't get into technically, but like your hand and your wrist, there's long bones that lead into the toes. There's a bunch of metatarsals, excuse me, in the ankle joint itself, which gives it the ability to move quite a bit. And then, of course, you've got the upper leg as well. So we're going to start by doing just a little bit of self-massage, doing passive work where you are touching and moving your own foot with your hands can be very palliative, especially when you've got a joint that hurts when you are moving it. So first things first, just doing some easy rubbing with the whole hand over the whole foot. And then you can also do some easy massage using things like the knuckles, especially if you have pain on the bottom of the foot or around the heel, and you can get into the foot quite deeply with that. You can go as deep as you feel comfortable as long as it's not causing pain. And, you know, pain from where you're touching, that's totally understandable. And then we're going to do some movement. So we're going to get those toes moving. We're going to put our hand over the toes. We're going to flex them down all the way and then bring the foot all the way down into this position. Watch out, you might get cramps in your foot when you're doing this if your foot hasn't been moving great. And then we're going to go back as well. And we're going to do that several times, back and forth, just flexing the toes and pointing the foot. And again, back and forth with the toes, and then big circles with the ankle, just to make sure that you get the fullest range of motion, back and forth both directions. And then taking the foot, you can get a little bit of distraction on the joint by just taking and pulling the foot away from the lower leg, and then turning it in and out. And then one of my favorite things to do is just to relax it, just give it a little shake. If you can't get your foot across your body like that, you can get it down much lower, or you can put it up on like an ottoman or another chair. So you can do as much of this as you can, or if you're lucky enough, have somebody else do it to you, of course. And then what we're going to do is we're going to get into some ankle tilt motions. Pat's going to stand in front here. He's going to have something close by, so that way he can use it for balance, because balance is not the key. He can either use a chair, or he's got a pole here that he's going to bring with him. And he's going to show you ankle tilts.
So if you were on last week, we talked about assessing and reassessing yourself to see how your brain and your nervous system is feeling about this, because as a quick reminder, pain is 100% a brain construct. So if there's threat coming from an area due to injury or overuse or hypersensitization, which is the chronic pain issue, then your brain's going to send pain to that area. So when we're going to do these ankle tilts, make sure you're doing some kind of assessment first, your pain-free range of motion. So whether you have hip, knee, or ankle pain, find what your pain-free range of motion currently is, and then retest that after each of these drills to see if this is beneficial for you. We would change this or modify them for clients in several different ways based upon what we see either online sessions or in the clinic. For right now, we're just going to run through some different options that you can try. So the first ones are ankle tilts. We're going to tilt to the outside, and then we're going to do it to the inside. So if I'm using my left ankle here, I'm going to start off in a good long spine position. I can also be seated doing this. And what I'm going to do is take my working leg, and I'm going to step about half a foot's length out in front, and then I'm going to turn my foot slightly inward. Now, my target joint is right below your ankle bone here and behind. It's called the talocalcaneal joint or subtalar joint, depending on which anatomy book you look at. And this is a joint that often gets jammed up. As we talked about previously, for movement, right, for your brain to feel good about an area, a joint specifically, there has to be some good space in that joint so the movement receptors have to send a good clear signal to the brain. So we're going to open this joint up gently by doing this drill. So my foot's stepped out, I'm turned in slightly, and then very slowly and gently, I'm going to roll my foot out. Now notice I'm not weighting this with my body. I'm just actively moving the foot out to open the joint and then coming back. This isn't a stretch, right? This is joint mobility. So we're opening that joint slightly. And this is a joint that commonly gets jammed up in people, especially if you're a runner or do a lot of hiking and that kind of thing. So all you have to do is about 3 to 5 repetitions and then reassess yourself. If you had, if you couldn't flex the knee, or if you've got some issues with range of motion in the hip, retest after that ankle tilt, or same with the ankle. Now, another way we can do this is to tilt the ankle to the inside. So to do this, again, I could be seated doing this. From a standing position, I'm just going to step out to my opposite side in a slight lunge. And then with this ankle, I'm going to gently turn in and back to flat. So we're opening that same joint, but on the inside now, the inside of the foot here, to open that same joint. Again, 3 to 5 repetitions is really all you need. And then you can reassess your pain-free range of motion. A lot of times people with those ankle tilts get worried, especially if they've had a lot of ankle injuries where they've rolled their ankle. And a lot of times what we find is that folks who have a tendency to roll their ankles a lot, if you can see can we see the foot okay, Doug? Mm-hmm. They tend to have a pronated foot, meaning they have a dropped arch, or the ankle is actually tilted in like this normally. So when they are hiking or whatever and they roll the ankle a little bit, not only is the tissue and the joint, the tendons, ligaments, and the joint itself not used to being in this position. Neurologically, it's also very threatening because they are most often to the opposite side. So getting this joint open and conditioning both the tissue and the nervous system that is okay can really be helpful if you have a problem with rolled ankles. Next one we're going to do is ankle circles. So for this, again, I'll be in a seated position. It'll be maybe a little easier. Okay, all right. So I'm just going to lift my leg off the ground, and I'm basically going to be turning the foot in motion. So there's really 4 points that I want to be able to hit in this circle. I want to be able to pull my foot back, like my toes towards my shin as far as I can. I want to be able to turn the foot then to the outside. It's called eversion. I want to be able to point the foot as far as I can, and then turn the foot to the inside, called inversion. So we're just combining those 4 points into a smooth circle. Now, if you're feeling any pain, if you have ankle pain and you're feeling pain, we're going to go both directions as well. So if you have any ankle pain in any of these positions, you can make it smaller and go slower. Because you want to be able to do this without any pain. Pain can be a skill, right? So we want to be able to get this movement without any pain. And if you can do it small and slow, over time, if you keep doing the drill, you'll get larger and larger full range of motion. So you can go ahead and assess your pain and try that, and then we'll see if that works well for you. Last one we're going to do for ankles is a calf stretch. Now, normally you see a calf stretch done what would be considered passively. So I'm standing here and I step back and try to stretch my calves by leaning. Not a bad thing, but we like to stretch as much actively as we can, meaning you are actually doing the motion. So to really stretch the calf, I'll do it from the side and then I'll turn to the front. To really stretch the calf, we need 2 ankle positions. I need to pull my foot and toes back towards the shin and then turn the foot outward. And then if I straighten my knee, I'll get more of a stretch. And then I can just relax it by letting it go back down, turn in slightly, a little bit of knee bend, and then go back into stretch. Pull the foot back, turn out, and straighten that knee. From the front, the stretch would be pulling back, turning out, and straightening that knee for an active calf stretch. So while passive stretching is not too bad, the reality is that's not what's happening when you're moving about the world. Your muscles are only able to stretch as much as you can actively stretch them. So for you to do it in an active sense, like I just showed, then that's usually more powerful for you and get you more range of motion.
Okay. So now moving on to knees, we're going to try to hit knees and hips in less than 10 minutes. So we'll see how this works. Again, start with doing things like the self-assessments again from last week, and then doing things like just skin stimulation and working your hands around or massaging around your knee is a good place to get started before you do these first motions. The first motion is this tibial rotation motion that a lot of people with knee injuries are missing and predispose them to injury to begin with. So if you find the 2 little dimples on either side of your knee and you put your fingers down on top, you'll find your tibia, and it feels like knuckles under your fingers when you push down. And then just lifting your toes up, you should be able to rotate your lower leg out and in. And notice I'm not having to bend or make my upper leg go out and in. I'm just rotating my lower leg out and in. And most people have a lot of restriction going in. And so as you pull in, and feel that the hamstring on that side really struggling to help, and that it is trying to. And so just see if you can feel that motion under your fingertips. Now you can do this standing as well, which we'll show in the video, but this is a fantastic place to get started here. Next, what we're going to do is we're going to do what's called a hanging knee circle. I'm not going to do it sitting down. It's much easier if you can to do it standing, but we're going to do it sitting down since a lot of people have a hard time with this. Now, at this point, what we're doing is we're just going to try to keep this lower leg relaxed. And then what you're going to do is to make this hanging knee circle is you're going to let the knee hang underneath. It's almost like it's working in a pendulum motion, but as you're doing it, it's going around in a circle. And it's a very relaxed position. And your hip might get involved a little bit, and that's okay. But we're not trying to do this as a hip pendulum. We're trying to make this a hanging knee circle. And we're going to go both directions. And go nice and slow, and as it becomes easier, you can pick up the speed. And when you do it standing, of course, you can really get the hip behind it and make it a much more athletic type of a movement if that works for you. Now we're going to do a standing knee circle. So this means that you're going to have something nearby to either use for balance, either like the pole like Coach Pat was using, or a chair nearby. And we're going to just do one knee at a time. So just taking that foot out, just like you were doing the ankle tilts before, put it slightly out in front of you, turn your toe slightly in, all right? And then we're going to do a knee circle where you're drawing a circle around your standing foot. You don't have to put weight through this. In fact, I prefer that you don't put any weight through this at all at this point in time. So most of my weight, 75+% of my weight is on my back leg. And I'm going to start with the knee completely straight, and then I'm going to gently make a circle around my foot beneath the knee, nice and slowly, again, keeping most of my weight over on the other leg, keeping good posture. I'm going to go 3 to 5 repetitions one way. You might get little pops and cracks. Again, there should be no pain as you're going through this motion. And if you feel discomfort, make the motion smaller, make it slower, and make it more relaxed. And see if you can't get any more out of that. And then what is the last one there? Femoral nerve glide. I'll let Pat, since he's got a block here that can be helpful here.
So there, Dr. Heisey spoke about the anterior knee pain and the patellar tendon and quadriceps muscle and things like that. So this is a great one if you've got some anterior front knee pain, which could be because of the quadriceps muscle actually and the patellar tendon. So the femoral nerve is a nerve that innervates the quadriceps here. This can also be good for some of the hip stuff. So remember this when we go to the next hip one real quick. But there's a couple ways to do this femoral nerve glide. The easiest way is to be down on one knee. So obviously, if it hurts your knee, if I was working on my left side and it hurts this knee to be on it, this is not the technique we want to use. We have to show you a different technique. I could use a pad or a pillow or something like that. I won't do that now just so you can see everything as well as possible. But to really get some tension, a nerve glide on this femoral nerve here on this side, I'm going to be in this position. So I've got a chair here for a little bit of support, and I'm going to put some joints in some very specific positions. I'm already in knee flexion, and then what I'm going to do is, if you think about the pelvis, I'm going to tuck my pelvis. That should immediately feel like more stretch on the front. So it's like I'm tucking my tailbone underneath, activating this glute and tucking the tailbone. Maintaining that, I'm then going to glide forward a little bit till I get an increased tension here. And then I'm going to increase the tension a little bit more by bending to the opposite direction and twisting. I can put my arm across my up leg to help with that. Then to kind of floss that nerve, I would gently push forward and back out of that. So this is not a static stretch position. We want to move to glide the nerve, and we do that by doing this position. So again, tucking the tailbone, I glide forward to get more stretch, I bend and rotate to the opposite direction, and then I just do little gliding of the pelvis. I can increase that more. by using something, a block, to give me more knee flexion if needed. Again, if there's pain to the touch by having your knee down, we would need to do it there are a couple different versions you can do, but we're gonna move this.
Yeah, definitely. Okay, so real quickly on the hips. Now, as you know, the hip is a very robust joint, but it is also very susceptible to arthritis and degeneration, particularly when other parts of the body are not moving well. This highly mobile and robust joint starts to take a lot of stress and damage in a very short amount of time. Again, touching around the area, massaging around the area, and such can be very, very helpful in this case. We're going to start with some very simple motion first, and I can't really see what I have on the list there. Oh, okay, gotcha. And then we did sciatic nerve glides last week, which we won't go through right now just from time. We're going to start with just some simple motion kind of related to the knee, and we're going to do that hip pendulum. So you can be seated off the edge of a bed or on a chair. You can even hold your own leg, good posture, and we're going to do those hip pendulums. So this is a different exercise than what we were doing before, because now we're concentrating on getting that hip to relax as we do this. Doing this for, anywhere from 10 to 15 seconds, several repetitions of this, and doing it on both sides. From there, what we'll do some open chain hip circles. I'm going to do this one seated, and we'll show a couple variations on the video that we'll submit next time. And so this open chain hip circle, basically what this means is that we're going to do a simple hip circle, but without the foot being on the ground. Now we can go both directions. You can easily go a little bit out to the side, and if you need a little help, you can support your own leg. Yeah, good. And then standing, you do the same thing, but holding onto the back of the chair. To stretch the back of the hip that Dr. Heise was talking about, with all of the muscles and nerves that are in the back there, it's very easy. There's two ways that you can easily do this just in a seated position. You can imagine you can be lying down doing this as well, is crossing that leg over. You might be crossing over here if you're very tight, and that's just fine. But two easy ways to do it: seated, one stretch out to the side, just pressing down, but then taking that and pulling the knee across to the opposite side. And you should feel a decent stretch right in the pocket of the glute back there, pretty significantly. Now, one exercise that Dr. Heise is particularly fond of, and we use often, is a glute bridge. Just make sure I'm still on camera.
Yep.
So lying down, either on a bed or on the floor, it doesn't really matter. And then head is going to be flat. Again, we're going to start with really good posture. So always elongate yourself and make sure that your posture is good. And then all you're going to do, feet are about shoulder width apart to start. And we're going to use both legs to start as well. You're going to just contract the glutes. I want you to be able to feel those. And if you have to, you can reach around and feel those glutes contract. You should feel the tightening of the muscle as you do it. And then as you keep that tight, you're bringing your hips towards the ceiling. Now, if you have back pain, of course, don't go that far. No pain in these drills. So remember to tighten up those glutes. You might even feel the hamstrings kick in. And as you go up, you should be able to feel it going all the way up, as well as going all the way down. And if you're good, you can narrow your stance, or you can go to even one leg to challenge that stability that Dr. Heise was talking about, and ideally be able to do it on both sides to get that symmetry on both sides. But being able to feel the contraction of the muscle as you're doing this is key. And if you've done all these movements up to the point of doing the glute bridge, it will be extremely helpful to making sure that those muscles click back in. So things to try at home besides what we just showed you. Again, the sensory stimulation and such, the idea of doing massage and such. You can use vibration, hot, cold, TENS unit if you've got it, things like that. try to do those stimulation things, a little self-massage and vibration for about 2 to 3 minutes, and then try moving again and see if that doesn't improve the way that that feels. And then try to do some of that stimulation while you're doing some of the drills. Just by holding on and doing light touch oftentimes can be very helpful. Again, if you're feeling any kind of discomfort, make sure that you change the speeds and the range of motions. And then as you get good, you can always increase the speed as you get better at it. And then you can start using things like light resistance bands to make it a little bit more complicated, but it also might make it more powerful in helping you with your pain. All right, there's a lot of things that we could be showing you, but we won't get into that today. So I'm going to stop my share. So we're back to in person, and I think that we can get into the Q&A part.
All right, guys. Well, we really appreciate everybody. I just want to share the screen one more time for the contact information and where we'll be next week talking about the spine at the same time. Just generally speaking here are the direct email and numbers for us in the offices in Monument for Dr. Higgins, Monument, Colorado, between Denver and Colorado Springs. And then Centeno Schultz Clinic, we have our 2 offices, North Denver and South Denver. So we want to make sure everybody has our contact information. And of course, we're doing our courtesy telehealth consultations if patients have questions, because you were so thoughtful and nice to spend your lunch hour with us today. So we'll be able to do that. Also, we'll put some more information on the email list, as well as I think right now Amelia just put in the chat box our contact. So we have the M. Heisey Centeno Schultz, Dr. Higgins at Neuroathlete, and Pat at neuroathlete.com. Please invite your friends. If you have family or friends that are in pain, let them know. If you have family or friends that might have had a procedure or surgery or even office visit for like a therapy or chiropractic adjustment canceled, if any of those providers are not seeing patients, that's the perfect outlet for telehealth. So let us know if there's anybody else we can help in your direct sort of circle, family and friends, if they need some consultation on how to help move forward with the current shelter in place and everything we can do in isolation.
Fantastic. Thank you.
Okay, thank you all. Everybody have a great day. Thank you.